Amputation is a irreversible loss of blood supply. Indication of amputation is number one, irreversible blood supply, severe soft tissue damage, malignant tumors, congenital anomalies, insensate limb following trauma, prolonged ischemia time. Two consultant to making the decision involve plastic and vascular surgeons, uncontrolled infections. Uh, the imputation cause increased oxygen consumption, inversely proportional to the length of the limb, hip disc regulation 100 to 150%, above knee amputation 60%, below knee amputation 20%, SIMS 5%, below knee amputation bilateral 40%, above knee amputation bilateral 200%. Principle: the stump should be cylindrical or conical, disarticulation in children to prevent bone overgrowth, myoplastic muscle to the periosteum or myodesis muscle to the bone, gentle tension on the soft tissue on the nerves and sharp sectioning to allow to hide and to avoid neuroma, bevel bone edges, drain to avoid hematoma, compression dressing, avoidance of joint contractures, early prosthetic fitting, physio and rehab, and psychologist. Ideal stump, full range of motion, full on proximal joints, non-adherent scars. Hind quarter, remove entire limb above pelvis to sacroiliac joint. Can't fit any prosthesis, difficult to sit due to the ischem. Transfemoral, 12 centimeter above the knee joint to allow prosthetic fitting. Do adductor myodesis, clears dynamic muscle balance, provides soft tissue envelope that enhances prosthetic fitting. Through knee amputation is a knee disarticulation, worse pain and performance compared to the above knee and below knee amputation, better sitting stability if bilateral, bulbous shape allow suspension, good in children as there is less complication from overgrowth of below knee amputation, causing skin breakdown and pressure ulcers. Below knee amputation 12 8 to 12 centimeter below the knee joint, minimum to retain the tibial tubercle and patellar tendon attachment, base of flap level with bone resection, long posterior myocutaneous flap, skew flap in ischemia as it has better blood supply posteriorly. A length of the posterior flap should be 1 centimeter longer than the diameter of the length, diameter of the leg at the level of the bone cut. Move incision away from the weight bearing area. Section fibula 3 centimeter proximal to the tibia. Ligate anterior tibial artery, posterior tibial artery terminates at the medial and lateral plantar arteries. Peroneal artery terminates as calcaneal artery. Symes amputation is basically ankle disarticulation. Remove medullae, mobilize and stabilize heel pad to the weight bearing area is the most important step. Viable heel pad critical for surgical success, more energy efficient than midfoot, even though it is more proximal. The problems with this happens because of fat pad migration. Chopart. Avoid equinus by lengthening tibialis anterior and transfer tibialis anterior to the tail and neck. Avoid varus by transfer of tibialis anterior slightly laterally. Uh, Hindfoot amputation through talonavicular and canacular joint. This frank amputation is equinovarus deformity is a problem caused by anabolous tibialis posterior and gastrosoleus, prevented by maintaining insertion of and transfer of peroneus brevis or tibialis anterior or lengthening. Transmetatarsal requires Achilles tendon lengthening to prevent equinus. Rocker sole help transfer weight forward while walking. Grade 2 amputation preserve 1 centimeter of the base of the proximal phalanx to, pres- to preserve insertion of plantar fascia and sesamoid bone and flexor hallucis brevis. Reduce amount of weight transfer to maintain toes and lessen risk of ulceration. Toe filler orthotic insoles. Upper extremity amputation. Wrist disarticulation. Transradial, easier to fit prosthesis. Transhumeral, shoulder disarticulation. And four-quarter amputation, poor cosmetic and difficult to mount orthotics. Complications, hematoma, infection, skin breakdown, flexion contracture, splint if at risk, phantom limb sensations, weight gain, increase energy demand, painful neuroma, back pain, psychological issues.